obviously, Pfizer was one of the companies that we were all watching during the pandemic. Such heroic work. Talk to us a little bit about what it was like behind the scenes. Obviously, a lot of people went home, but there were people who had to do mission-critical work and had to stay here. How did you suddenly change things around to make that happen?
You know, I think our purpose is pretty strong at Pfizer, breakthroughs that change patients' lives. So it really acted as a North Star. And you said it really nicely with the heroes, because we call them our heroes. Our manufacturing colleagues showed up every single day to make life-saving medicines. And our research colleagues also were hard at work to make sure that they were really looking for a cure, looking for some ways to bring this pandemic to an end. And they gave up lots of their personal time to be able to do that and dedicate themselves. We very quickly, for the rest of us that were able to work from home, pivoted very, very fast. And when we saw what was happening, and we just said, we're so driven by what we need to do that we're just going to do it in a different place. You know, we're a global company. We ended up, there's a lot of travel that was involved pre-pandemic, so it wasn't anything that was completely dramatic. We were used to working wherever we were. But this, collectively, we made sure we had the tools, the resources, the guidance, and we, really made sure communication was clear with our teams to say, if you need something, let us know what you need to make you as most productive as possible, while also keeping the fun, because that was really important.
But you also had to keep safety.
Yes.
You're in charge of innovation. That had to be innovation in the moment.
Yeah.
How did you make it so that people could do this important work, yet at the same time be safe themselves? I'm thinking about the researchers who often have to be right on top of one another.
Right. I mean, as Payal described, you have to create an environment where there's the physical safety for everyone, and there were countless protocols in place to ensure that that happened. But at the same time, it's also creating the psychological safety to be able to engage on solving an incredibly important problem. And a lot of that comes down to cultural elements. How do we engage with each other? How do we actually get quality focused time, whether it's in person, whether it's hybrid, whether it's virtual, on solving the problems that needed to be solved? And how do we create the right atmosphere of urgency, because there was tremendous urgency to solve these problems, but also give people the time to think, to brainstorm, to generate and challenge each other on how to advance things. And it was a combination of all of that together that created an environment for individuals to succeed, and ultimately for a life-saving treatment, both in the form of a vaccine and an antiviral, to come to patients.
I think about how so many people suffered burnout, particularly when you talk about healthcare workers. They were certainly energized by the moment and the need to be heroic, and they rose to that occasion. But we've seen so much burnout, so many people leaving the field because it was just exhausting. How have you all handled your teams after having done such heroic work at really such a high level of stress? Where are you now in terms of how you handle that with your personnel?
Yeah, I mean, we provide a lot of resources because we believe it's important. You bring amazing innovation when you are at your best, and you need to be making sure you're taking care of your, not just your work, but also your life. And so we've really integrated it and brought a lot of resources to our colleagues, not to
like
just
what?
Mental health and awareness. We have a program that we partner with Global Thrive, and we make sure everybody has an app. We also do sessions on a regular basis with intact teams, and we also make available to them, if you have an issue, there's lots of places to go. We have what we call safe space listening sessions, and it is bringing together people on a particular topic that's going on in society, because it affects you mentally. So allowing them to come together and giving them the resources, but we remind colleagues and our managers that the mental health and wellness of our colleagues, if they can't be at their best, they're never going to bring their best to work, and our patients need our best. So we've multiple different kinds of resources available for their use, and not just allowing them to find it, but we're bringing it right directly to them.
And how has the environment changed in terms of how people work together now? We hear a lot about younger people in particular saying, I'm out of here, I'm moving to the next job. You know, you've been here for 25 years and have moved from job to job within the company. How do you keep that same sense of urgency and excitement, and the energy of having triumphed to create the vaccine and the antiviral? How do you keep that moving now?
I think it's a very interesting question because I joined Pfizer just a little bit over a year ago. So I came into an environment where there were many of the dynamics that you described earlier in terms of just how intense the experience had been for everyone to reach such an important milestone. And we have lots of tools, as Payal described, to address some of those challenges. The interesting thing for me that I observed was there was almost a even renewed energy in the organization to say, wow, we just did something incredibly important for the planet and for humanity. Now, let's do that again, and let's figure out what are all the other problems that we can bring this kind of mindset, our resources, our capabilities to try and solve. So I think there's a real balance in that, too, and how do you harness a lot of that energy and direct it to the kinds of problems that we aspire to solve in terms of bringing breakthroughs to patients. And so a big part of it has also been tapping into that energy that's been created by this incredibly important moment in history for us.
Can you give me an example of something that is really that kind of a turning point in terms of how you work and a shift and a change in the way you work?
Sure. I think an example I'd like to point out is just the importance of speed. I think it was very evident in the pandemic because it needed to be solved with urgency. I think we've taken this concept of speed now and tried to apply it to everything that we do. So for instance, if we can find a way to take 3 years out of the timeline of developing a drug, which can last orders of magnitude longer than that, that is 3 years faster that we can bring a medicine to a patient and start saving lives. And in order to make a change like that requires tremendous ingenuity. But there's a belief that it can be done because we were able to do it in the course of the pandemic. Now, maybe not all the same factors exist for every human disease condition out there, but we know it's possible. So that's an example of something that we're very focused on in terms of how we make decisions, how do we accelerate the clinical trial process so that we can bring these solutions to patients even faster.
It sounds like it puts more pressure on everyone.
I think it puts pressure to come up with ideas. It is not just a matter of let's all of us work harder to get to that same outcome. I think what it creates environment for is how do we create very different ways of thinking. So there is a traditional model for how we recruit patients into clinical trials. It's been in the industry for decades. And now we're asking ourselves, what if we were to just turn that on its head? What if we were to create partnerships with large cities? What if we were to take AI technology and machine learning and apply that to this problem? What are different ways in which we can solve it? So the pressure is to solve the problem. The pressure isn't to simply do what we were doing before and work much harder to achieve the same goal in the same way.
And when you think about some of those problems and some of that new approach, there is a whole new expectation about work now, where people expect that there's more flexibility. We've seen so many people leave jobs, even as the labor market is starting to feel a little iffy. Payal, how do you deal with that, and what are you doing to respond to this new sort of expectation of the workforce?
Yeah, I mean, I think, workers really want, and people in general, want to be tied to a purpose. And I think, one, we have the best purpose that, one could offer. But the other part is flexibility for the jobs that will allow for that flexibility. As you mentioned, you can't be making products at home. I don't think anybody would want to take those.
No, thank you.
Can't be coming up with the best science just at home. You need to collaborate. But there are lots of other roles that you can do, not completely at home, but you have a lot more flexibility. And that gives you choices. And we've implemented a policy that says, post-COVID, whenever our country operations in the US, whenever it's safe to come back, we follow the local guidelines, you come back, but you don't have to come back every day. But when you do come back, you come back with a sense of purpose to collaborate with one another. And that has been really widely received positively. People are excited. They miss each other. They want to come back. And I think the other piece,
how often are people in the office?
2 to 3 days a week is our guidance. And, I think people are dipping their toe in as offices are opening up. We're in the process of actually moving our headquarters office, so we're expecting a lot of people to come in and see what their new facilities look like. And they're going to look very different. They're going to be a lot more collaboration spaces rather than little offices, because we've all proven that we can do our emails from home. Right? When we come in, it should be for conversation. It should be to build trust. It should be to come up with that next breakthrough. And we build on each other's ideas. And I think the other piece, people are asking for is growth in their careers. And what we really are offering across Pfizer, like you mentioned, I've been here over 25 years, and I don't think I've held a job in the same way for over 2. Because we continue to change and iterate and evolve as an organization. There's so many opportunities. And what we're really encouraging in our population now is to do what we call zigzag moves, going from one department to another department, completely different discipline. And you get different experiences, which allows you a 360 view on a particular problem. We've had over 500 moves in the last 2 years now, and I'm really proud of that because it meant people took chances and said, I don't have to leave because I can get a whole different experience by just looking at a different department that I wouldn't have otherwise thought of.
How prevalent is it that someone would do that? Or some people, I mean, I would imagine if you were, a researcher working on a lab bench, you're not necessarily going to go into marketing.
That's right. That's right. And I think it happened less a few years ago. It's happening a lot more. And there are definitely some disciplines that allow for more of that to happen than others. Some folks are really excited, and that's perfectly fine. We continue to challenge the way that they operate and, give them enrichment in the jobs that they're doing. And there's far others in our digital group, in our marketing group, in our manufacturing group. Actually, I had 2 people on my team that used to run businesses that joined HR, our people experience is what we call it. And we had somebody for people experience going to digital recently. So it's amazing what you do for yourself or as an individual, but what also you bring to the team that you're on and the company as a whole. You look at a problem very, very differently.
What do you think the last couple of years have brought to you in terms of thinking about leadership and in terms of really engaging the workforce? Obviously, you have a CEO who is himself very engaged and very demanding. How has that shaped the way you're thinking about keeping that workforce engaged now? Our CEO, he's very passionate in all that he does, including our workforce. And the past 2 years have been incredible with, what's happened throughout the world in this pandemic, not only to bring a solution, but to make sure we were taking care of our colleagues and investing in them. So no matter where we were, it was what do the colleagues need to do their best work? Ensuring that we had all of our tools, our resources, giving managers freedom, making sure that, the ability to attract the right kind of talent, and also leveling us up, basically showing us that when you aim high, it's amazing what you can accomplish. And so I think organizationally, when I think about the colleagues that work at Pfizer, they don't just rest on their laurels. They want to do more. They want to solve the next issue and crisis, whether that's for patients or even for society. And that's the kind of workforce that we are. So if, people are just interested in status quo, it's not going to be the place for you. And it probably will be really uncomfortable. But for those that actually want to make a difference and be able to change the world, send me your resume. Aamir, if you think about sort of the biggest innovation that has come out of the pandemic, clearly the vaccine and the antiviral, but in terms of the way we work and the way you motivate staff, what would that be?
I think, to me, it would be a combination of authenticity in leadership and a unbiased way of making decisions. I remember one of the first things I experienced when I joined. There was something that happened, and I wanted to deal with it in a certain way. And I remember calling Payal and saying, hey, this is how I would normally have dealt with this, but how do we kind of deal with that here? And I remember her saying to me very clearly, you should deal with it in the way that you feel makes the most sense. And I think that through line of authenticity and leadership is something that every person at Pfizer feels quite deeply, and I think has felt very empowered to bring that as a leader to the organization as a result of what's happened. Now, in terms of what that means for driving innovation, I think an element of that that's very personal to me has been, how do we just inject more and more objectivity and decrease bias in how we make decisions? And I think that is, you can draw a very straight line from that to how we're going to innovate. A great example is, how do we think about this universe of science that is exploding outside of the four walls of Pfizer? Clearly, tapping into that was a big part of how we brought the solutions to the pandemic. And as we think about everything that's happening, we feel like we should be doing even more of that. And that's quite unique in an industry where a lot of times it has been very biased towards what was invented here. And I think that kind of way of thinking about it can lead to more breakthroughs, and it can lead to breakthroughs faster. So these types of injections of authentic leadership and an unbiased way of thinking, to me, are some of the most important lessons that will unlock a lot of innovation for Pfizer going forward.
And has the workforce also stepped up and shown, what have you learned from them?
I've frankly learned that colleagues are full of absolutely amazing ideas. And the more that we can create authentic engagement to actually talk about them and create forums where we can problem solve together. Much of what I do in my role involves pulling in colleagues from many, many different parts of the organization, different countries, different functions, different disciplines. And a big learning has been that if you can create a forum and set an incredibly high ambition and bar for what you're trying to do, it's quite limitless what colleagues' ingenuity will be to drive solutions. And I think the more of that we can do, the better.
And finally, it seems as though you two are very much in sync, and I would imagine if Albert were here that you'd all might be finishing one another's sentences. How important is it to be able to be authentic with your leadership, with your CEO, and how direct is your access to him to be able to say, hey, this isn't working, we need to change course, or this is working really well, we need to change course to really do that?
Want me to start?
Sure.
So I think, he's just a push of a button away, or just walking into his office. Yeah. He FaceTimes when he's not with you, and will actually demand that you be honest and transparent. And that's when we have the best decisions. Even through the pandemic, there were, as we were going through the trials and before we even had a vaccine, there were lots of decision points. And we weren't always all on the same page. And he would call, our meetings were very much about, go around the room, around your Zoom circle, your Brady Bunch circle, and say, what do you think? Without any judgment, and making sure that he was drawing out every opinion, and then collectively would make a decision. So even if you started somewhere at the end and you may not have agreed with it, you exactly knew where you were going. So we always feel, I personally do, I'll let Aamir speak for himself, but you can always be yourself, and he expects it.
He's an incredibly accessible leader, not only to those on his leadership team, but frankly to anyone in the organization. And he is guided by a very clear North Star, which we all share, and that is our purpose. And we make decisions based on that. And he's incredibly unbiased and objective in his decision making. So if there's a better way to serve that purpose, even if it's a totally different solution from what we all discussed and agreed yesterday, but we've got a better answer to it, I think it's an expectation that he has of all of us to continue to raise the bar and challenge. And we're going to do what's best to achieve our purpose. And if that means pivoting and changing, let's do it, let's decide, let's execute. And I think that kind of environment permeates because it allows other leaders to create a similar atmosphere. And that's what drives organizational innovation from all ranks within the company.